Hi, in today's post we're going to be talking about sciatica and low back pain. And the first thing I want to bring out to you is, yes, I am a chiropractic physician, but typically we get pigeonholed into the idea that this is all we take care of. And that can't be further from the truth. You can explore the rest of my website and understand that we're looking at the person from a whole. And yes, a part of the body called the low back or the part of the body called the leg can actually get pain. But the reason why these areas can get pain is because the nerves that are attached to them are now being interfered with. So typically low back pain, yes, the problem can be in the low back, but understand, yes, nerves can be interfered there. There could be disc problems. There could be problems with the nerves coming through the rear end, the buttock, where the nerve is being impinged upon by a muscle that's malfunctioning. But the understanding should be this, is that you need to find out why that area is malfunctioning in the first place. It could be a physical issue, no doubt. There could be a disc problem. There could be muscular imbalance. There could be brain imbalances. See, when you have persistent chronic pain, that pain is only pain when the areas of the brain that deal with pain are brought to threshold. In other words, they're being activated. So you could have problems for months or years before you even have the awareness that there's a problem, and that's when the problem should be taken care of. So I don't want to be pigeonholed to the fact that this is all we take care of. We take care of a lot of other things. The idea of wellness is our main thing, of keeping the body's nerve system intact. So the idea is, yes, you could have a problem in the low back, but you could also have postural distortions up top that cause the low back to react to that. So in other words, if you have a postural distortion where you have forward head thrust, of rolled in shoulders, that could put undue stress on the low back. And if you don't take care of that, then you're never going to get back that back pain or that sciatica taken care of. So yes, identify whether you have a disc issue. I myself have disc issues, and I don't know where they came from other than the fact that it's probably us old injuries that were never taken care of. This is before I knew about these facts. But the idea is you can have disc issues, you can have muscular issues, you can have impingement at the spine itself, you could have upper spinal issues up in the neck, shoulder region, postural distortion, also contributing to that low back. There's some research to show that when the person's under lots of emotional stress, that's what can drive a low back pain issue. The reason why is with stress, there's going to be reductions in how much blood flow gets to a muscle. As a result, the muscle starts to malfunction. Everything needs glucose and oxygen, and that's what the blood flow brings. So if there's restrictions in blood flow due to stress on the person, whether it be emotional stress, in my opinion, stress is not just emotional. It could be physical from old injuries, car accidents, sports injuries, or it could be chemical. You're constantly inflaming the body with foods that you shouldn't be eating, or have a blood sugar issue which inflames the body, or an adrenal problem, which is a stress problem. That causes all sorts of problems with how blood flow gets to areas, fuel delivery gets affected when you're affecting the emotional centers. But the idea is stress can also be playing a factor. So you could have stress of an emotional type, stress of a physical type from old injuries, old car accidents, stress from upper body problems like causing distortions, stress in the problems with the brain and how it's interpreting pain. In other words, if you're constantly having an injury down below and that's driving improper information up to the brain then gets involved. I have talked about how in other posts, if a part of the body gets injured, the part of the body that in the brain, where the part of the brain that represents that part of the body starts to shrink. So, if the part of the brain that represents this low back has been dealing with an injury for long periods of time, that part of the brain starts to shrink. That's been shown in research. So as a result, how do you think that brain now is controlling that body part? It's a vicious cycle. So you do have to deal with the local injury. You have to deal with any other upper body injury, postural distortions. You have to deal with the nutrition. And you may have to deal with getting rid of the stress or controlling that stress in your life. The whole idea with the stress, though, is to get your body dealing with it better. The more intact your nervous system is, the better able it is to interpret the environment, the better able you are to adapt to stress. So keep that in mind when you have sciatica and low back pain. It's not a matter of just treating the low back. Everybody wants to do their core exercises, that type of thing. The idea is those are important, but you need to get to the cause of why that problem is there in the first place. And that involves looking at all the body parts, not just where the pain is. So I'd like to thank you for watching. Find a doctor who understands these principles. And I'd like to thank you and hope to see you soon on our next post, and make it a great day.